Welcome to this fourth episode of Educhat with Dr. Sujit. I'm sure that you people are enjoying this episode series, and I'm so happy that many of you are asking so many questions. And you know what? It's getting tougher for me day by day to select your questions because there are so many good questions which are coming up. And as I promised, the best question every week is going to get the free copy of my international bestseller book, New Age Dentalpreneur. So keep on pouring questions every single time. And here's one more thing. Those of you who are part of my online community already, and if you find that your question is not getting answered in any of the YouTube videos of Educhat, you can always ask those questions in our private Telegram group or the online session that I conduct specially for you. So keep on asking questions, and let's start with the fourth episode of Educhat with Dr. Sujit. And today, the voice of question behind the camera is Shivani. So Shivani, what's the first question?
Dr. Upendra has asked how to solve the confusion to settle as academician or clinician or both.
Okay, so the confusion, and I'm sure, very good question. It's always there in a lot of people's mind whether to settle as an academician or a clinician or both. So it happens when you pass out from your BDS or MDS, and then on one side you don't know whether you should start a private practice, or you don't have the confidence, not from the clinical knowledge front, but maybe whether the practice will run or not. There is a lot of competition, or shall I work for a few years in the private college or government college, wherever I get the job, and then start practice. And you know what? You go to private college or any college, you get that job, and you become that assistant lecturer, then lecturer. You slowly get used to the private or the college environment, and you go into the comfort zone. And it becomes very difficult for you after a few years to come out of the college and start your practice. Especially when you are in one of the departments of the college, and you know everything about that subject, all the treatments, but then you lose the touch of other treatments, other departments, and then it becomes even more difficult to start the private practice. So in and all, what's the solution? And in my opinion, at this moment, it reminds me of a very powerful quote by Dr. Stephen Covey. He says, always begin with the end in mind. And this is one of the biggest mistakes a lot of dentists, they make out once they move out of the dental college after their graduation or post-graduation. They don't begin with the end in mind. And the end is not in sight or in mind simply because there is no goal setting. You exactly don't know whether you want to become a private practitioner or you want to be the part of college and then eventually rise to the next level, become the reader, the HOD, the dean, the faculty, the PG guide or whatever. And then you get confused, and that is not correct. Okay? So always begin with the end in mind. Don't join any college after your graduation or post-graduation just for the sake of doing it. If you are very interested or if you are inclined towards academic part of the curriculum or maybe some research, then you should join the college. Otherwise, the better option is to join a private practice. Work as a locum, work as assistant, learn everything, not just the clinical skills, but the management part of practice, the patient consultation part of practice, the marketing aspect of dental practice, and then start practicing after a few years. I hope you got the point. Begin with the end in mind, do your goal setting, be very clear, don't join college just for the sake of doing it. Eventually, you will land up in a comfort zone. I have seen so many participants in different courses, that they are in the college, they're not enjoying it, and now they don't have that confidence to go out and start the practice. So it's not about your expertise I'm talking about. It's your mindset that keep on changing. You go into the comfort zone, you get sucked into that particular lifestyle that becomes your life. So whatever is decision, there's nothing right and wrong in this world. Another mistake when people are more confused they make is they try to do both. Half day college evening practice And you know what? In that way, it's so difficult. It becomes very difficult to settle in just half day practice. That means evening practice. Because there are too many dentists around. Many of them are really good by means of marketing, patient consultation and treatments. And then, you literally land up being nowhere. So you are neither happy there nor happy here. So while you do the goal setting, to move from that confusion to clarity, one of the aspects can definitely be your liking and your strength. As I said, if you want, to enter into some kind of research, or if you love to teach people, if you want to create more successful dentists or create a difference, just join the college. If you want to make a difference in the community by helping them by relieving their pain, start the private practice. But don't put both the feet in two different boats, because you will never be stable in life. I hope you got that. Right? So, Shivani, what's the next question?
Dr. Amit has asked how to retain staff in dental clinics.
Okay, staff retention. Very, very difficult, right? In fact, getting a good staff itself is a very difficult and challenging thing. And retaining them is even more difficult. But I'll tell you what. You should understand human psychology, the element of human psychology, if you really want to retain good people with you. See, in fact, getting a good staff is probably not as difficult as to retain them. And it's not just about dentistry. In any business profession, the challenge of retaining good team members always are there. So understand the human psychology. Ask a simple question to yourself. Why people work nowadays? You will be surprised to find that majority of them do not work only for money. Believe it or not, gone are those days when the basic human needs like food, shelter kind of things were the challenges. Roti, kapda, makan. Like maybe our parents or forefathers generation used to work for those basic needs. Nowadays, those basic needs are fulfilled. When someone comes to you for interview as a staff, at the age of 20, 22, 25, in fact, their basic needs are already sorted. They already have a good mobile phone in their pocket when they come for the interview. Right? So it's not the basics. It's not the money alone for which they work. It's honestly not even the luxuries of life, because many of them already have probably the same television set at their home which you have. Okay? They probably already many times have a better mobile phone than you. Okay? So the basic necessities and the basic luxuries, the comfort of life is already met. Nowadays, people work because they want to do something different. People work because they want that space at the workplace. People work because they need a good work culture to work. People work to get the experience. People work to bring out their creativity, to learn something new. Now, as a practicing dentist, if you do not provide these things, trust me, it becomes very difficult to retain the staff. Never think that, in fact, I have seen a lot of dentists asking me this question. I give very good salary, but still I find challenges in retaining people. I told you already, gone are those days when people used to work only for money, because at that time, money was the highest priority. Now, a good workplace is a priority. A good leader is a priority, not a boss. And in fact, it's always said, people never leave organizations. They always leave their bosses. So in this 21st century, always remember this. If you really want to retain your team, develop a good work culture. Give them space. Give them the ownership. Give them the sense of belonging. Make them loyal towards your work, towards your practice. Take their opinions, take their feedbacks, give them some creative task, challenge them. They will love it and they will be there. That's the best way to retain the staff. I hope you got the point. Yes, Shivani, what's the last question of the day?
Dr. Sandeep Lachwani has a question for you, doctor. How to communicate with patients if we're calling a specialist for a particular treatment?
Okay, good question, Dr. Sandeep. How to communicate with the patients if you want to call a specialist? That's always a challenge for many practitioners. Simply because the moment you tell any patient that, somebody else is going to do your implant, a super specialist dentist is going to do your disimpaction surgery or whatever, they look at you as if you don't know it. Whether you know it or not is a different thing altogether. But then, when patient looks at you, or few patients literally end up asking you, that means, does it mean that you cannot do it? Or doctor, why don't you do it? Or can you do it yourself? Because see, even patients are comfortable with you. They are in the comfort zone when they are in your clinic, and they want you to do everything. When people come to you as a patient, that's the trust. They have heard something about you. They have read somewhere about you. And when they come to you, they are like, you are absolute full-fledged expert in their eyes, the best dentist around, right? And when they come to you, and when you say someone else is going to do it, then, they are like, their confidence gets shaken. They are shattered. Oh, why next? So does it mean that I came to a wrong clinic or wrong doctor? Or, there can be tens of such questions which can pop up in their mind. How to convey it rightly? Because it's very important. And the initiation of this conversation depends on the kind of question patient asks. Okay, if the patient says, doctor, why don't you do it? Or आपको नहीं आता है क्या? आप नहीं करते हो क्या? Okay, so in that case you can say, see, we do all the treatments. I myself can do every single treatment. So for whatever number of years you are practicing, say it. It's like, since 5 years I am doing everything, since 10 years I am doing everything. But you know what? There was a time when there were no super specialists. There were not too many super specialists available in our country. But nowadays, if we have the experts, like for example, if you are calling an endodontist for a root canal, and you can always say, don't you think someone who do root canals day in and day out will definitely do it at least 1% better than me? So the entire motto of our practice is to ensure that you as a patient should get the best treatment. It should not matter who is going to do the treatment. We always work and strive to give the best to the patient rather than ensuring and exposing in such a way that I know everything and I am the best. No, nobody can be best in everything in this world. Now when you say it to the patient is also definitely working in some business or profession, in some industry, or maybe doing some job in IT or wherever, and they also know that even in their workplace there is not a single person who do everything. You can give that example as well. And this is the best way you can convince patient. And in fact, I sometimes go one step beyond in my practice and say to patients that, tell me one thing, do you want to get the treatment done from me? Or do you want to get the best treatment? So the patient naturally says, I want the best treatment. Now, if you want the best, get the best implant, let this person do it rather than I do it. So it doesn't mean that I don't know how to do a good implant, but the entire purpose is to give the best treatment to our patients. Okay. So with this, I think we are done for the day, done for the episode. And wonderful questions. I really enjoyed answering today's question. I'm sure you enjoyed being part of it. But wait, don't leave, because we have to select the best question of the week, the question of the episode, and the person is going to get the copy of my bestseller book, New Age Dentalpreneur. So which was the best question of this episode? And yes, right, it was Dr. Amit Majetia who asked about how to retain staff in your clinic. So congratulations, Dr. Amit. Wonderful. You have won the copy of my international bestseller book, New Age Dentalpreneur. Please, our team will get in touch with you. Make sure that you put your shipping address here, or maybe email it to us, and we will send you. You're going to get a personally autographed copy of New Age Dentalpreneur book. Right? So with this, we come to the end of the 4th episode of Educhat with Dr. Sujit. Put your comments in the comment box. How are you finding this? Is it useful? Right? Put your questions and I'll select best of the best questions in the future as well. So this is Dr. Sujit Pardeshi signing off as of now. I'll see you next time in the next episode of Educhat with Dr. Sujit. Thank you.